All right, I think we are ready to go. People are still popping in, but as we have just 1 hour for an interesting topic to exchange on, I would say let's start the event. Hello and welcome again to everybody online for this very exciting meeting on discussing scopes and partnerships in risk sharing and humanitarian action. I'm very excited to see a very diverse audience online, an impressively diverse group today. My name is Darina Pellowska. I'm a research fellow at the Center for Humanitarian Action that we like to call CHA, and I will be your host today. On today's panel, I am joined by two speakers. That is Mehdi Pouyan, who is the Desk Officer for Principles of Humanitarian Aid, International Disaster Relief and Humanitarian Demining at the German Federal Foreign Office, GFFO. Hello, Mehdi, it's nice to have you. Thank you for joining us today.
Hi, and hello, everyone. Thank you for inviting me.
It's a pleasure. Mehdi Pouyan will elaborate on GFFO's journey on revisiting risk management practices, and this will hopefully spark a vivid discussion among you, our online participants, and our speakers on options for donors to engage in risk sharing. But before we'll dive into this discussion, we will give the floor to our second speaker, who is Christine Knudsen, the Director of Humanitarian Policy at Interaction. And Christine will share latest learnings from the risk sharing platform and also contribute some views from Interaction's international NGO members and their partners on the question if, and if so, in how far risk sharing has an impact on partnerships between international, local, national organizations. Christine, it's a pleasure to have you here as well. Welcome to the panel.
Thank you very much, and good morning, good afternoon, good evening to all.
Yeah, I think after the two inputs of Mehdi and Christine, we will hopefully have some 25 minutes for a vivid engagement among ourselves. And also you in the online audience in a Q&A block. So please have your thoughts polished and your keyboards ready to write everything you wanted to share on the topic into the chat. My colleague Johanna Fipp, who will introduce herself in a minute, will collect your inputs and present them to all of us online. So we are looking forward for many inputs in the chat, and we actually depend on this also because we want to make this a very engaging exchange, actually. To start off the discussion, I will contribute some insights that Johanna and I gained from our own CHA research on risk sharing. However, for the discussion to be a fruitful exchange, I think it's very important that we first have a look into our housekeeping rules. Johanna, do you want to explain these?
Yes, thank you, Darina. So, hello, everybody. I will quickly share our housekeeping rules to ensure a smooth meeting today. So this event will be recorded and afterwards published on the YouTube channel and on our website. And to ensure that everything works well, please turn off your camera and microphone unless asked otherwise. The meeting language is in English. There are Zoom live transcription enabled. You can access it via the menu bar below. And if you need any technical advice or assistance, please send a message to CHA Technical Support. There's our colleague Micha, he will help you. And Darina already said that. Please feel encouraged to post your questions and comments related to the topic here in the public Zoom chat, or if you wish to post your question anonymously, you can send a private Zoom message to me, and I will collect them and monitor the chat, and then I will bring it back to Darina and Christine and Mehdi. Yes.
Thank you, Johanna. Yeah, as I said, we wanted to start off this discussion with some findings from our research. Last year, Johanna and I had the pleasure to contribute to the discussion on risk sharing with a chart paper that we called Implementing Risk Sharing in Humanitarian Action, Findings from Bangladesh. And why did we turn to Bangladesh? It's simply because from our earlier research, we knew about some quite advanced humanitarian partnerships in Bangladesh, which describe themselves as at least trying to be locally led and equitable, and this has been acknowledged by local partners as well. The risk-sharing framework postulates principles that are closely linked to the principles of equity and local leadership. And that's why we were curious to learn from the approaches of these advanced partnerships to risk management, and wondered in how far this may be even early forms of risk sharing from which the community could learn. So we interviewed some 36 key informants who were working in Bangladesh and beyond. Some of you are here. Welcome to you. Shout out to you. Thanks again for sharing all your experiences. And yeah, please feel free to comment in the chat if you feel misrepresented. So what Johanna and I did first to understand the different extents of risk sharing that we anticipated to find was that we divided the process of risk management into 4 sections. That is, first, risk identification, secondly, risk analysis that weighs the identified threats according to their potential impacts and likelihoods. And the third step would then be defining some risk treatment tools and mechanisms that could reach from risk avoidance to risk transfer outside the humanitarian partnership to risk mitigation. And we subdivided risk mitigation into 2 parts. That is preventive risk mitigation, that is mitigation techniques that try to reduce the likelihoods of risks to occur, and responsive risk mitigation techniques that are trying to reduce the impact as a risk materialized. And last but not least, we have accountability. Of course, when a risk happens and occurs, we need to account for any costs in relation with that, any damages or losses. And full-fledged risk sharing would then implicate that humanitarian partners, so donors, international organizations, but also local and national organizations that they work with, collectively approach all these sections and all these stages. So that would be joint risk identification, a joint risk analysis, a collective approach to risk treatment, and accountability. So what we found in our equitable partnerships in Bangladesh was that, unsurprisingly, they indeed practiced risk sharing, but however, unfortunately, only in parts. It seemed to be easiest to apply risk sharing in risk identification and analysis, as well as in preventive risk mitigation. And I think that's a finding that has been also validated in the risk sharing tabletop exercise of the risk sharing platform. So there are a myriad of examples for sharing risks in these categories or in these steps. For example, we found the joint development of risk registers is already practiced. That could mean that the different partners actually sit together on one table and identify risks together, but it could also be a decentralized cooperation where the different partners work on shared documents wherever they are. We also find examples for security risk mitigation by all partners sharing their security intelligence, for example. We found tailored trainings that meant to reduce risks induced by a lack or a loss of capacity, mainly of national and local partners. And well, prominently mentioned were flexible rapid funding mechanisms that prevented operational risks originating in a quick change of the humanitarian context. So these are very good examples. However, responsive risk mitigation and accountability were areas where we didn't find so many examples. And especially donors, and that's the first finding that we wanted to discuss here with you today, seem to be hesitant to engage in these two steps. Still, we found very few rare examples where they did engage in these two steps. They, however, needed some concrete circumstances to be in place for them to be able to do so. And that is first, that the risks materialized unintentionally, that is because of reasons that lie outside of the humanitarian partnerships, external factors that were connected to the hard working conditions in which the partnerships worked towards their humanitarian objectives. Secondly, they needed their humanitarian partners to have very strong preventive risk mitigation measures in place that, due to whatever outside reasons, did not work out as they were planned for. And thirdly, they needed their partners to promptly and fully disclose all the details of the risk incidents and work actively together with them to respond to the risks. But because this is the rare exception, our second finding was that international organizations continue to function as risk buffers that are primarily responsible for to account for losses and damages from materialized risks, and that are also mainly engaged in managing risk responses. And for this reason, partner assessments of local organizations play a crucial role for international organizations in their risk sharing. So local partners that were found to be already very capacitated by international partners, so that were found to be already very well equipped to prevent and respond to risks themselves, they were paradoxically preferred as partners in risk sharing. And I think that is the two findings that I wanted to contribute to spark off the discussion for today. And with that, I will hand over to Media Bojan with maybe a response to the first question or the first finding. So given the finding, how do you think donors can become more effectively involved in risk sharing? Should risk sharing be scaled down and just for expectation management, only deliberately involve donor engagement in selective areas, effectively maybe sparing joint accountability for materialized risk? Or can donors, with their constrained room to maneuver, still contribute to far-reaching risk sharing, as we have seen from the rare examples in our study? Midi, over to you.
All right. First of all, thank you for the really interesting input in setting up this meeting, and maybe to answer the question in a short way first and then in a long manner afterwards. I think it's really important to engage in this discussion, especially and I can only speak from the GFFO side, from the German government side, of how we perceive this process. We are very much eager and interested to actually support the increase of risk-sharing measurements or measures across the delivery chain. The question remains, and this is something which you have hinted at in your findings, how much influence do the donor side actually have in the day-to-day process of risk-sharing? And especially from the GFFO side, as we are mainly operating our humanitarian assistance programs via our partners and intermediaries, we see our role not only in risk sharing, but in a lot of other policy topics, not really to enforce the change in the system, because we believe that according to all multilateral formats and discussions and forums, everybody's on the same page, basically on the idea of these topics, especially risk sharing too, and localization is another one. What we try to do is really enable our partners to fulfill this processes, and especially in a risk sharing case, what we try to do is we try to identify our levers from our side first and see what we can do and what we already are doing in the day-to-day operations. And this is not talking about piloting the framework in a specific manner, but really in our day-to-day operations as we have done it in the previous years. And what we see is, especially, we focus on collaboration and this kind of eye-level dialogue with our partners. So they are able to really communicate potential risks from across the delivery chain. So what we also try to do is not reach out. We directly cooperate with our intermediaries, but this doesn't mean we don't try to reach out and also encourage our intermediaries to connect us with their operational partners on the ground and the local organizations in the regions. So they also have the feeling that they can openly and directly contact us in regards to different risks and problems they perceive in their day-to-day operation. And the other process which we already are doing, and which is also a central pillar of our strategy for humanitarian assistance, is this open and direct and most specifically non-punitive dialogues we have with our partners. What we try to really encourage them, and this is something I can say in talks I have with other organizations, which is very much implemented into in the DNA of how we operate, that everybody really have the feeling that they can communicate every possible manner of risks they perceive, at least. We're not saying we have identified all of them at the same time, but every risk we have already perceived at the beginning of the project phase. And we are trying to encourage us even more as to implement also or integrate also the local partners into this process. So they are also integrated at the very beginning of setting up a project. So they are also integrated into the communication and non-punitive manner, so they can tell us their perceived risk dimensions. The next step is in regards to where we can really share the risk. And this is something which I wanted to emphasize also in this format, is we have to do a very specific expectation management across the delivery chain. So from the donor side, we are also constrained by our budgetary laws in how much risks we can share. And I think there's a certain degree of misconception, especially from the operational partners, that risk sharing means a very heavy focus on financial risks. And this is something which we too, as a ministry, as an operational entity, are constrained by our own budgetary laws. So in these dimensions and regards, we are very much constrained by the laws of our certain governments. What we can do is share or really try to mitigate risks not only before but even afterwards. And this is kind of the responsive part of the question. Share the risks in different dimensions, and one of the most prominent ones, and hopefully which is also helpful for our intermediaries to be able to have this kind of open discussion beforehand, is the reputational risks for our partners. So what we really try to do is emphasize, tell us the risks beforehand. If something happens, have a very clear and open communication with us, with a zero tolerance of inaction in every different risk dimension. But at the same time, there is no danger for you for upcoming projects or other projects to have any kind of impact. As far, and you have said that in research too, as far the risks have been communicated to a certain degree beforehand, as far as it could have been humanly known. And this kind of flexibility we try to really provide and also communicate in the way we operate with our partners. The other risk dimensions where we are very willing to share the risks and to support the system are security and access, which we also do in parts of, according to our humanitarian diplomacy efforts, where we see problems in these areas where we are not directly involved anymore in the operational side. As I've said, we are only working indirectly in most cases, but we are very, very willing to support even local organizations via our embassies. If there are problems, they are free to contact us. We try to support them from Berlin or from our embassies to really share or mitigate the risk in these dimensions, as in security and access, as far as we can do this. And the other one where we try to, which is according also to enablement, is to support our intermediaries to be able to really have this kind of flexibility with their local partners in regards to planning the projects. So, which is also one of our main levers for our localization agenda, is really setting up our projects as flexible as possible and as multi-year as possible. Because we know one of the main risks for grassroots organizations and local partners are really being able to plan their operations and plan their staff over a certain period of time. And this is one of the risks we have identified in years ago, and we have tried to really mitigate it and support the system by setting our projects accordingly. And the last one is, and this is actually a rather newer one we have identified and worked on, is the political risks of setting up humanitarian assistance projects. And this is something, and interestingly enough, it's not only a top-down maneuver from the donor side, but also something which the whole system can support. So something everybody can even share our worries to a certain degree, where we should try to really communicate better the way we are operating in humanitarian assistance, communicating humanitarian principles, may it be via media or social media, or the way we are really directly in contact with the affected populations in the regions. So what we see is there is a lot of bias and political baggage in a lot of cases in humanitarian scenarios, where we try to support the system from above, but we also need the support of our partners, intermediaries, local organizations, to really make clear the message of humanitarian assistance. So this is one of the risks we all carry and we should share commonly. And yeah, maybe to sum it up, the expectation management is we are very much willing to support operational risks, absolutely, and we are already doing this. We are trying to set up, and as an outlook from the GFFO side, we are not only trying, we are currently setting up piloting projects where we try to really test out fixed frameworks of how to operate more clearly, as in having set up calls and structures or monthly, quarterly, half a year with our local organizations and the intermediaries and us to really have an open dialogue on a regular basis. So to really counteract your critique, maybe even in your research, to have the risk mitigation constantly updated and responsive in the manner. And we are working on piloting these processes and see what kind of best practices we are going to extract from these and see where even more levers are for us. The one thing is, which we really try to emphasize, is to have maybe even for the whole system, to have a more clear communication on what risk sharing and risk management in the humanitarian assistance context will mean. Because at the very end, one of the things which will not be possible for the GFFO is to be able to really stem or share certain financial outfalls. Because as I've said at the very beginning, we are also an operational part of the chain. We are also accountable to our own government. So we try to be enabling as far as we can to a certain degree, but I think some aspects will remain, as certain players, and in some cases it's the donors, in some cases it's the intermediaries, will have to play a certain amount of the role of a risk buffer, as you've said. I'm unsure how the system will work in any other way. To a certain degree, everybody has to take risks in deploying assistance in highly volatile regions. But we try to be as encouraging, as openly, and as really on a partnership level with our partners in doing this. Thank you.
Thank you, Mehdi. These have been very interesting steps that you've taken. And I just wanted to encourage our online audience. I know that there are some representatives of donors from other countries there. If you have any steps that you want to share, feel free to write them in the chat. We are all eager to learn from each other here today. But before we will turn to the inputs from the chat, I will give the floor to Christine Knudsen to speak more about the second finding of our research, let us know what the risk sharing platform is currently doing. Christina, the floor is yours.
Thank you. And thanks to all for joining what I hope will be a very lively exchange in the second half of our time together this morning. I really wanted to note with appreciation during the work of CHA and this research that you've shared. I think it's incredibly valuable and very clarifying around some of the challenges, and also speak with great appreciation for Mehdi's candor in discussing the limits of what can be considered and what is not practical to be considered. And I think it is this dialogue which is at the heart of a conversation around risk sharing. And I say that because there are so many assumptions that we have been making around risk sharing, risk management, risk tolerance. I'm in a slightly curious position today, presenting some of the work and findings that colleagues at Interaction and across the risk sharing platform have actually developed over the last many years. I have only recently joined Interaction, and I wanted to invite others who are on this call, who are participating directly in the platform, to please complement anything that I will be sharing this morning. The credit really goes to Interaction, the Netherlands, and ICRC for coming together and presenting this platform, I think in a very constructive, honest, and candid manner, to really start thinking about these assumptions that we take. The platform as well identified several principles that can guide us in a framework to discuss risk sharing, but let me just speak to maybe 3 points to start. One is, as Mehdi was saying, there are different kinds of risk. And when we say risk, the first assumption has always been around financial, fiscal, fiduciary, and looking at that as the risk to be managed. And I think that we need to unpack that term to be more effective in thinking about sharing, just as you and Mehdi have already pointed out. The political risks, I think that was a very good addition and very much appreciate that insight. Safety, obviously, security risks, legal risks that can be mitigated, operational risks, reputational risks, information risks, and we can talk about data even within that. But the final one I wanted to point out is ethical, and the ethical risk, including the risk of not acting. And this is something that, as we are looking within the Grand Bargain and other initiatives, what are the risks of not acting when we are committed to putting people at the center of our response? And I think this is a conversation that needs to take place in different operational contexts and across the entire delivery chain. We know that where there is financial misconduct, fraud, or corruption, there are certain consequences. But let us not be in a position where it is the people who are punished when they're in greatest need. So there are some conversations to be had around that, partnering at intermediary level and at local level. So I think unpacking what we mean by risk is important. The second point is really what you were saying as well, certainly jives with everything we found during the tabletop simulation that was conducted late last year, and be very happy. I believe it's posted publicly now, the outcome report from that, which echoes a number of your findings as well, Darina. Certainly, we are all in this sector very comfortable with risk identification, risk analysis, and strategies for risk mitigation. That has occurred, I think, across our platforms for a very long time. But then what is the threshold where we can say we have conducted with our donors, with our partners, with our entire ecosystem, we have done our due diligence to this threshold, and we recognize there will be residual risk. How will we respond when that risk is in fact realized? Because it is likely in some cases, even with the best due diligence, that some of these will occur. And I think we all know that, as Mehdi's final point was, we all take risks when we are operating in highly insecure environments. What is the threshold for adequate mitigation and adequate consideration and adequate mitigation strategies? So that conversation around when is it enough is important, because otherwise, and I think, again, maybe this is just bringing some more clarity to it, we know that otherwise there will be what we call the perverse outcomes, where the risk is identified. We say that we must have zero tolerance for any kind of diversion, absolutely. Yet that can lead to a climate of insecurity and secrecy, and that leads us to not identifying, in fact, the real levers that we may have, the shared red lines that we may have, and solving a problem through collective consideration. So I do think we need to, again, have a dialogue around this. And it has to be based in candor, trust, and confidence. And that comes to my third point, which is this takes time. And we are, in fact, talking about a shift in our operating culture, right? And this is, I think, something we need to be a little bit more clear about in some cases, because one of the critiques that has been put forward to the framework is it's too long, it's too complicated, it's too complex, it doesn't tell us what we actually have to do. And I push back on that in saying it's not prescriptive, it is guiding. And there has to be a space for that conversation, for that analysis to take place. And that, regrettably, or perhaps positively, does take time to be a process. And again, as Mehdi has pointed out, where there are known, large, trusted partners, this is a different kind of conversation. Then what is the next step in that delivery chain? Having that discussion, passing on the flexibility, passing on the analysis of risk and conversation with other partners, which are context specific. So the fact that we are talking about a process rather than a tick the box, we are talking about a dialogue as opposed to a reporting form. You know, this is where we are talking about a shift in how we approach the work, because in fact, what we want to do is complement putting people very much at the center of our response. This has to start with understanding the assistance that is required, the protection risks that populations are facing, and what kind of modes of assistance that population wishes to receive. And from there, what are the risks? And from there, how do we engage? And so really turning that dialogue in a very different way to enable a more people-centered approach and managing the risks accordingly. This is not only a top-down conversation around fiscal risk, it is a much more comprehensive conversation around risk with people at the center and the heart of that. So I just wanted to put those issues out there, because I do think that that has a choice then on partnering. And as you said, because of the concerns around residual risk, around risk responsiveness and risk accountability, transfer of risk, there is a natural tendency to partner with those local partners who are the most robust in that area and resemble the intermediary itself. The only way we will be able to address that, I think, is over time and over a challenge that we need to pose to ourselves. There is an assumption still that local organizations don't have the capacity to be able to provide fiscal management, security, risk management. And I think that that challenge really needs to be put front and center. It is false. It is, in some cases, a false assumption. In some cases, it is based on traditional models of assistance. And I think we need to be very clear and put ourselves squarely in the middle of saying that is not true, that there are local partners who have different strengths, who have different complementarities, who have different approaches, and working with them and challenging ourselves, perhaps in a second period, to really go out and seek those diverse partnerships in the service of people we are trying to support ourselves. So I'll stop with that. I've put a few issues on the table. I know time is running. So hopefully that will provoke some conversation. Thank you.
Thank you, Christine. I already noted some questions, and I'm also sure that Mehdi, you wanted to react on what Christina said and vice versa, but let's give the floor to our online audience first. As I see many people from different backgrounds are joining us, and that's why I'm giving the floor to Johanna first, who had an eye on the chat. Johanna, what's going on there?
Yes, thank you. So there's something going on, but please feel free to add some questions and comments. I will collect them. So maybe what the first a bunch of comments and questions were related to MEDI and to the question of financial and fiduciary risks. So here are some comments. For example, one comment on how different risk appetites differ. So that, for example, that the appetite is different with program as compared with finance and legal departments. And there's one question from Lisa from German Red Cross concerning, okay, so how do we influence German budgetary law if it doesn't make sense to apply it for spending in crisis, conflicts, and disasters, and to improve financial risk sharing? And also the question on to expand a bit on financial constraints GFFO has. Yeah, maybe we can start with that. Yes.
Thank you, Johanna. I think these are directly to you, Mehdi. Do you want to take over?
All right. And unexpectedly, there are a lot of questions in this topic. So basically, I can't say any fixed idea or plan in regards to how we are going to handle the sharing of financial risks, because, as I've said before, there are very strict constraints in regards to budgetary law. The problem is in regards to sharing them to a certain dimension, we are not fully constrained in regards to risk mitigation. There are project constellations where in certain risk dimensions, may it be, for example, an expected financially volatile situation in a region where paying the local staff will be impossible with a fixed budget, for example. It's absolutely possible to integrate this risk and the financial outcome of this risk beforehand into the project. If you can present it, and that's also all according to the open dialogue, and as far as it's understandable and being able to holistically approach this in a certain scenario, it's possible to plan this into a project setup. In case of financial fallout and compliance outcomes, there are currently no plans in regards to sharing those risks, because, as I've said, it's not only the question for humanitarian assistance, it's a generally question of how budgetary law works for Germany, and where we are also very much constrained not only in financing humanitarian assistance projects, but every kind of project, where we, from the donor side, still have to be accountable to our taxpayers. So it remains the question how far anybody in the delivery chain is able to predict financial outcome risks and mitigate those to a certain degree. We are at any point, we are trying to support our partners in a non-financial way to mitigate these risks and to relieve some of the stress of these risks. But at the same time, as we have said, everybody across the chain is to a certain degree involved in taking risks to deliver what we do in these scenarios. How far you can influence the budgetary law? Honestly, we would be happy to have more leeway, but this remains to be seen as to how far, especially in the current times, budgetary law will be even more flexible. And this is one of the things I have to emphasize from the German government side. We are already trying to really stretch out the maximum amount of flexibility for our project partners. Yeah, I think a lot of you who are cooperating with us in different constellations have seen this. We're really trying to set up as flexible as multi-year, however you can define this, the projects to really be able to respond not only to a very fixed idea of a humanitarian crisis, but really on a broader spectrum. And these are already very much stretching budgetary definitions on how we are how we are able to spend and set up projects. So we will be happy to be more flexible. Everybody is free to set up ideas and communicate them to Parliament. We are always happy to support you in any way to have more flexible budgetary or less budgetary constraints, but currently at the moment there are no fixed ideas. So this is why, and instead of really digging us into a battle which is really difficult to fight, we are trying to focus more on the non-financial dimensions of risks and to support our partners even more on those ones. As I've said, the operational risk, the political risks, the security risk, and we are trying to mitigate and share those as far as we can. It's a difficult answer to a difficult problem, sorry.
Yeah, I already have some follow-up questions, but I also want to give the floor to Christine, because I think this relates to a thing which you mentioned earlier in your input, that it's important to diversify the discussion on risk sharing with regards to the diverse dimensions of risks, right? So different humanitarian partners may have different buy-in in risk sharing depending on the different risk dimensions. And I think that's also something which relates to the question in the chat, or to the experience shared in the chat, that they have different experiences from financial funding departments compared to program departments. Is this something that you also found in the tabletop exercise?
Absolutely. And I think the other and complementary part to that is unpacking risk, but then also unpacking risk tolerance. Because as we've been hearing around, for certain parties in the delivery chain, there is really no space for sharing of risk around a fiduciary role. However, identifying that, surfacing it, and making it clear is already quite important to the dialogue. There might be higher tolerance for risk and residual risk in some of the other areas that we've talked about. And I do want to come back again to the ethical risk of inaction. And that, I think, there's a tension here, of course, because we have to weigh where there is a high tolerance and a low tolerance, where we are actually talking about mobilizing a response to support people in need. When we are unable to do so because there is a zero tolerance for diversion, for instance, what does that look like? What are our mitigation strategies if we are all committed publicly, privately, ethically, morally to act? Where do we find space for collaboration? And so I think that, again, there is no quick answer to that. It has to be in a space of dialogue and a robust dialogue. And this is where, again, the framework that was collectively developed provides principles to come back to shape that dialogue. And there, the tabletop exercise was very rich in showing that in every one of the concerns that came up, sticking points, there was a principle that could help to unlock the conversation. And so I think there is some real value in having that guided dialogue to be able to surface some of those tensions and then address them to an extent. There's no perfect solution in our world, but there are different coping mechanisms and different approaches. And the more diverse participation in that dialogue, the more likely that there will be interesting propositions, interesting solutions, alternatives, or approaches. So there is still something here to be said around diversifying the voices, diversifying the partnership, and diversifying the conversation, whether there is a fiscal role in this or not. There was another point that I wanted to bring in there, but I'm afraid I'm drawing a little bit of a blank on these next steps. But understanding that the guidelines, the principles can really leverage a different kind of conversation around some of these points. So if I've missed a point, Darina, please remind me. It's been a bit of an early start to my day, so sorry about that if I've missed one of your questions.
No worries, and appreciate you being here and joining us in this early time for you. Maybe let me turn back to Medipoyan. There has been a little bit of more inputs in the chat. I'm sure you want to react to those, but maybe to add a little bit from my side, you mentioned that you're working on a better communication of your own approaches and also your limitations in engaging in risk sharing. And I found this to be very important in the research, because sometimes, you know, different donors and even different departments of donors have different approaches and the different residual risks that they would be accepting. So maybe you can elaborate a little bit more on that. How do you create this, what Christine also mentioned, open and valued space where partners can approach you with a within a non-punitive dialogue? Maybe you can expand on that.
And before I go into answering this question, just as a follow-up, what Christine said, something, and this is also very much a nice emphasis on the whole open communication in regards to the topic and the dialogue we have on risk sharing. Something we also have to keep in mind, and this sounds maybe a little bit weirder from coming directly from the donor side, but everybody is carrying also their very designated risk package. And what we've seen is in the previous months and also years even, that from the donor side, we also carry a lot of the pressure in regards to any kind of risk or compliance outfall. We carry maybe not the financial risk directly, but we very much carry the political risk of keeping up the system and the work we all are trying to do and continue to do. And this is one of the interesting things that everybody considers even the same risks in a different dimension. So for us, in a lot of cases, it's not directly the problem of the financial outfall, but in the next step, something we still have to consider and to counteract. In some cases, even on a let's say lonely front, are the political outfalls we have inside of our countries sometimes. So emphasizing on what Christine said, it's really important to keep up the dialogue and keep up the discussion around the topic, even from also from our donor side, considering what kind of risks we would like to be shared more cooperatively. So, and to answer your question directly on two different angles. On a general angle, we are already doing these non-punitive dialogues on a day-to-day basis in our operations. And the next emphasis of this topic will be inside of our humanitarian strategy, where we will be again emphasize high-level cooperation across the delivery chain, not only with our direct partners and intermediaries, may it be larger NGOs, INGOs, or international organizations, but also with local organizations, having an open door policy of keeping in touch, contacting via embassies, via our ministry in Berlin. And the next dimension is, as one of the potential outcomes of our piloting, we will be testing different kinds of formats in regards to outcome and effort, and analyze what kind of setup or intensity of meetings and formats will be useful for our operations, also for our partners, and not overburdening them with an additional administrative effort only for one certain topic, but really emphasizing the importance of the output of this kind of dialogue channels. So we will see and we will test some different formats, and hopefully after our direct piloting phase, which we will be trying to stretch out into multiple regions and countries, we will see what kind of format could be established and recommended across our operational departments in the GFFO. So in a roundabout way, we are doing some hopefully high degree already, but we will try to framework it more after we have seen it or tested out different ideas in our piloting phase. We're trying to really be hands-on in this topic, hopefully.
Darina, can I just pop in very quickly on this? I realize that the point that I wanted to make is very much related to Mehdi's comment here. In this dialogue, what we have found as well is that there has been, by the intermediary or the further onward recipient of funding, an extremely conservative reading of rules and regulations, requirements, that is excessively conservative, excessively risk adverse. And in these dialogues, being able to open a conversation to say, actually, this is going to be permitted under the current rules and regulations, as opposed to assuming a risk intolerance. There is actually an interpretation which can be opened up. And this had to do with, for instance, we can't have funding for security measures in our grant to a local organization. Well, no, you can. It may not be in your overhead costs, but you can put in a line item, and that will certainly be acceptable under our rules and regulations. So even within a regulatory framework, which is very much guided by public law, there is open possibility to explore different ways of bringing that flexibility, understanding, and operational reality into the dialogue. So I just wanted to bring that back into the conversation as well.
Thank you, Christina. And this directly relates to something that I wanted to point out that is also currently discussed in the chat, namely the culture with which we are approaching risk and risk management, right? If it's a risk-averse culture, that means that everybody is expecting to be punished. And if we want to break this down, or if we want to break this culture, renew it, then we also have to address power imbalances that persist within the humanitarian system. Also apart from risk management. So it really interrelates with the whole localization debate, and that has been highlighted in the chat. What I found together with Johanna in our research was that for this openness to engage in risk sharing, there is one very critical thing which is often overlooked, namely the readiness to talk about risks, actually, or the knowledge of risks, the knowledge of these systems that are in place. And sometimes some informants of very big international organizations have frequently mentioned that they are just now addressing these issues for themselves. And I see that Marieke is trying to join our conversation here from the Netherlands Ministry of Foreign Affairs. I'm happy to give you the floor in a minute, just bear with me. I just wanted to finish my thought. That is what we need to have these conversations. We need to have a little bit of a learning also from all our sides, which about risk and risk management. And this needs to take place, and often also in UN organizations, in donor organizations, and also in local and national organizations. Marieke, you're here with us. I'm giving the floor to you.
Yeah, thank you so much. Thank you so much for your presentation as well. And your first statement about donors really triggered me, and I think that was exactly your point. So thank you. Thank you for that. I think the findings of your report make sense, right? I think that the main conclusion is that at the moment there is still a lack of risk sharing, and I think that makes sense. And I think the risk sharing framework was exactly a response to that. And I feel like at the moment there is really, also when I look at ourselves, we just started piloting. We're really at the start of having these dialogues, meaning that the results of these dialogues will lay still a bit in the future still. And I think there is quite a risk in focusing on donors who are at the moment not piloting or not implementing risk sharing, because that really takes the attention away of this coalition of the willing. And because there are quite some donors who are committed to piloting risk sharing, we're taking their first steps. And I think there is really an added value where this coalition of the willing is trying it out, finding the limitations, finding where the room is, even within the contracts. And of course, hopefully you want to also adjust some risk management practices. But I think there's also a lot of low-hanging fruit that can be won when it comes to finding the room that is already there within the legal obligations. And I think if this coalition is trying this out and really aggregating all these lessons learned, exchanging, building that evidence, and also building the good examples that we will hopefully implement, that can really serve as a tool to get other donors who are a bit more hesitant to also get them on board. So yeah, I wanted to switch the focus a bit on what is being done, and maybe to also mention here is that at the moment we're looking, like the Netherlands is planning to really facilitate a space so that piloting actors have room to exchange, to really provide a platform to be able to talk about how the process goes, exchange lessons learned. So more about that later. Thank you so much.
Thank you, Marieke. And this responds directly to a question from the chat, whether there are some practical positive examples where risk sharing was already perceived as fairly shared between all the humanitarian partners. And I think that's the answer. There are some pilots on the way, but at least to my knowledge and my research, I didn't find any. But I'm happy to learn otherwise from Midi and you, Christina. I would give you the floor for some final comments, and before we close this meeting. Thank you. Christine, do you want to start?
Well, I was just going to build on, I don't know if these are concluding comments, but we are looking, especially within the Grand Bargain, how we can create a community of practice, if we can build, as Marieke was saying, this platform where the learning, the coalition of the willing, the organizations, actors, donors that are actively committed and engaged in exploring this tool and this approach can share in a space that is convenient to that. Because again, I think even the learning that we have is going to be challenging in some cases, identifying and feeling the risks and the contours of what is possible. But this is important work, and this is going to take time and attention, because it will not happen without both of those things. This will not happen, the shift in our conversation, the shift in power dynamics, the shift in really meaningfully putting local action at the center of humanitarian assistance will not happen without intent and design. And I was inspired a little bit with my coffee cup this morning. It's impossible only if we refuse to attempt it. So I think that was my concluding comment this morning. And we will be coming back, I think, to this group and the community at large with that learning as it comes forward. It won't be tomorrow. It won't be next week, but it will be a fruitful dialogue, I think, over the many months to come as we are exploring, applying, and looking at some of this framework learning in some of the most challenging contexts currently. So thank you again so much for participation today and for inviting us to share some of our reflections. Thank you.
Thank you, Christine. Very inspiring thoughts. Midi, do you want to add?
Difficult to add anything. I think we can agree to everything which had been said during the conversation, especially also from the colleagues from the Netherlands. We're really happy to be able to engage in the discussion. We are open to have more conversation, may it be on a multilateral format, bilaterally with everybody across the delivery chain, may it be local partners, intermediaries, or the governments. And we will be looking forward to share what we will be experiencing in our piloting phase. And hopefully, and this is also our approach at the GFFO, to really get away from only the theoretical work, because we have identified across not only this topic, but a lot of topics, we agree on the benefits of it. We really have to identify now the operational levers and options we have and share these best practices across the chain. And yeah, we are also trying to start with the low-hanging fruits, of course, but hopefully it's not going to end there, and we will continue to increase mechanisms to be as enabling as possible for our partners, and especially for the colleagues working on the ground, and in as far as possible to really support the people affected. Yeah, thank you.
Thank you, Midi. I have taken a lot with me. I see even more questions in the chat. I'm afraid we couldn't talk about everything today. We just had 1 hour. Thank you for everyone who stuck with us and yeah, engaged in this discussion. Please stay tuned. We as CHA will remain engaged in the debate. There is more to come. And yeah, thank you everyone for your interest, for your inputs, for your efforts, even in the early morning, Christine. Thank you, especially
Thank you so much. Thank you for letting us in. Thank you. We'll keep in touch. Okay, bye.
Bye-bye.